Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, QualCare Inc., a local managed care company covering 750,000 New Jersey residents, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. PSE&G, committed to improving New Jersey's economy and strengthening its communities. Fedway Associates, Inc., the Russell Berry Foundation, and by Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Hi, I'm Steve Adubato, coming to you from Philadelphia, the city of brotherly love. We are here at the Healthcare Collaboration Summit, sponsored by Virtua and CHOP, the Children's Hospital of Philadelphia. I had the opportunity in these chairs, this chair and that chair. I was sitting right there, sitting one-on-one with Ed Rendell, the former governor of the Commonwealth of Pennsylvania, the former mayor of Philadelphia. We went one-on-one in front of an audience of over 200 people. It was a very candid, dynamic, spirited conversation. The audience was involved and engaged. We talked mostly about healthcare reform, Obamacare, if you will, the Affordable Care Act. It was an important conversation, one that you will learn a lot from, because Ed Rendell is one of the most interesting, candid, dynamic, and fascinating people you will ever meet here on public television. It's an interview you don't want to miss. Ladies and gentlemen, it is my honor, my pleasure. I want to thank Rich, I want to thank Virtua, CHOP, and I want to thank everyone in this room. You know, it's one of those things when, I don't know, you may have heard, Governor, the federal government shut down. A little bit in the news. Things happen, you know. Some of the speakers that you have aren't able to show up. But then real leaders decide to take that situation and make the best of it. But it is rare, as Rich said, that you take that situation and, frankly, no disrespect to those who cannot be here, you make a better situation out of it. But for me, as a broadcaster, as an interviewer, to have the opportunity to sit down and listen, sitting down with Chris Christie is always a pleasure. Well, let me take that back. It's sometimes a pleasure. It is always engaging and enlightening and fun with Chris Christie, and combative at times, but never dull. And I expect nothing different, but with an interesting Philadelphia and Pennsylvania twist to it with Ed Rendell. I have watched him for a long time. As an NBC and MSNBC analyst, I have admired him from a distance, being a Jersey guy for a long time, as the mayor of Philadelphia from 1992 to 2000, as governor of the great state of the Commonwealth, of Pennsylvania, from 2003 to 2011, as an analyst for NBC, as a partner at a major law firm in this area, frankly, as a great citizen of this state, of this nation, as a leader in this country, and as someone who is important to listen to, whether he talks about health care or any other issue. Ladies and gentlemen of the city of brotherly love, his city, join me in welcoming the one, the only, the Honorable Ed Rendell.
Thank you, Steve. I just want to say two things before we get started. One, I am a substitute. I was asked about 2 o'clock yesterday afternoon, but I'm happy it worked out so I could be here because I have great admiration for Virtua and CHOP. CHOP, I believe, is the best children's hospital in the world, but both Virtua and CHOP are on the cutting edge of trying to transform our healthcare delivery system with the emphasis on prevention and outcomes more than just traditional visits and traditional service. Secondly, I'm very pleased to see that there were apples outside. Almost my first speaking engagement was when I was the young district attorney, and I got an invitation from the Philadelphia Association of Cardiologists. And I went to their dinner, and they had big ribeye steaks. So this is far more consistent. I don't know what you're eating, but the apples outside are far more consistent.
Well, Governor, let's start with this. Your book. Now, I mean, sometimes books do not have the most provocative or interesting title, but that is not the case with Ed Rendell. Correct me if I am wrong, Governor, but the title of your book, A Nation of Wussies. Wusses.
Wusses.
Oh, I apologize,
Big
Governor.
difference.
A Nation of Wusses, how America's leaders lost the guts to make us great. So let me ask you, Governor, a nation of wusses, to do the right thing when it comes to health care. Right now, in Washington, it doesn't seem like, after everything that has happened, we thought something great had happened with the Affordable Care Act. What is happening now, and are they wusses?
Well, first let me say this. I supported the Affordable Care Act. I thought it was going to be good for Pennsylvanians. And on balance, it's a good act. Is it a perfect act? No. Are there changes I'd like to see to it? Yes. Are there changes that most people in your industry would like to see to it? Absolutely. And that should be done. You know, bills are not the Ten Commandments. The Social Security Act has been amended 31 times since it passed into law, 31 separate times. So it should be an ongoing process. And if we had any sense of maturity, any sense of commitment to helping the American people, that's what we'd be doing now. Instead of, this is so nonsensical to attach changes or demands regarding the Affordable Health Care Act to the government shutdown. It makes no sense. I mean, if the president were to give in here and negotiate, then anytime either party wanted to do something to get their way, they just do political extortion on the sitting president. You can't let that happen, because once you do, you open the door to everything. Now, the president has, in fact, said on a number of occasions, and he reiterated it, once you take the gun away from our head, I'm happy to talk to you about the Affordable Health Care Act. We're not going to gut it. We're not going to change it. We're not going to get rid of or delay the mandates, and I know we're going to talk about that later. Sure. But I'm happy to talk to you. And there are serious Republicans who've got some serious ideas that I think would make the act better. But everything's confrontational in Washington. And yes, everybody's a wuss. I will give you the perfect example. And I don't mean to speak ill of people who probably would have been your speakers, but if you read today's Inquirer, there are 5 Republicans from our general area, from our TV market, who said they would vote for a clean continuing resolution, meaning keep the budget, the government going without having anything to do with the Affordable Health Care Act. That's Congressman Dent, Congressman Gerlach, Congressman Fitzpatrick, Congressman Meehan, and Congressman Runyon.
You're not naming names, right?
No, it was in the paper today. They said it was in the paper today. The question is, do they have the courage? Are they enough of non-wusses to go to John Boehner and say, we want you to have a vote on this, no strings attached, it's a clean vote, and if you don't, we'll sign a discharge petition. And that's a very important point. The way the House operates, the Speaker and the Majority Leader control what bills are voted on. They can bottle up a bill forever, but there's one remedy, and that is if 50% of the House, 50% of the members signed a discharge petition, that bill goes to the floor for an up and down vote. So if those 5 congressmen want to do more than just act like good guys, if they want to be good guys, they'll sign a discharge petition, which is going to be circulated soon, and force the bill to be voted on, regardless of what John Boehner thinks.
Let me ask you this. This is going to be resolved one way or the other, hopefully. Hopefully. What do you say to those governors who say, you know, you said it yourself, it's not perfect. The Affordable Care Act, Obama Care is not perfect. What specific changes, if you could go back, forget about the repeal, not going to happen, not practical, right. Votes are not there to do it. If you were to say right now in retrospect, Friday afternoon quarterbacking, I know you love football. If I could go back right now, I would repeal it in these ways because it would be a better law, it would help patients, their families, hospitals, and everyone involved in the healthcare system, I would change these 2 or 3 things. What would they be?
Well, the first thing I would do is not so much repeal anything, but I would put more cost savings into the bill.
What does that mean?
Things to bend the cost curve. So, for example, something very easy. Emergency rooms are the most expensive forms of treatment we can get. And 50%, and you guys may have different stats, but I was told when I was governor, 50% of the people who go to emergency rooms, Steve, are not looking for emergency care. They're going because their dog bit their hand and they need a stitch, and it's 10 o'clock at night and there's nowhere else to get it but an emergency room. I wanted to require, and I think this should have been in the act, that every facility that has an emergency room also have a non-emergent care 24/7 facility staffed by nurses and nurse practitioners. So when I've got that, I'm playing with my dog and she accidentally bit me and I've got to be stitched up, I don't go into an emergency room and compete with people with gunshot wounds or heart attacks. I go to the non-emergent room where a nurse treats me at 40% of the cost, and the nurse is absolutely capable of putting, I say mercurochrome, but that gives away my age, putting some...
That was that orange, red stuff.
Right, and then stitching me up. That should be mandatory, and I would like to see some of that. That's a very simple example. Hospital-acquired infections, huge cost driver and a huge detriment to our health. Should be more in the act about that. Chronic diseases, which are 80% of the cost in the healthcare delivery system, we've got to have put in place new methods for treating and for paying for the treatment and care of chronic diseases. The act gives states some money to try that, but it's not strong enough. So I would strengthen, we've got to do something about the cost curve. We are the most expensive country in the world when it comes to providing health care, and our results are somewhere in the middle of the pack. They're not anywhere near number one.
When it comes to the exchanges or the marketplace, or whatever it is you choose to call it, Governor, are you surprised in the first few days at the number of glitches, the number of breakdowns, the number of screw-ups, the number of problems, as people go on the website, healthcare.gov, attempt to access the system, get health insurance that heretofore they have not had? Are you surprised, A, at the number of those problems, and B, at the response of most people in the federal government handling this, who say, be patient, relax, go back online tomorrow, sit there for another few hours, figure it out, be patient, and when you get on there, I know it's a little complicated, but it's all worth it, you say?
Well, look, Apple launched something 6 weeks ago, and it totally broke down, and they issued an apology, and you know, that was Apple, you know, probably one of the most successful companies in the U.S.
Do people want that more than they want health care?
No, actually, it's interesting. In the first 3 days, 7.2 million people went online to try to access healthcare.gov. Southwest Airlines, in an entire month, gets 6.2 million hits on their website. So this is an extraordinary response, showing that people really believe they need help and they need this. And I think there will be glitches, but I think the glitches will be smoothed out. Look, a launch of a program of this magnitude with so many people involved. Remember, you're going to ostensibly add 31 million people to the healthcare delivery system. That's obviously going to take some time. So I think the response by the government is pretty reasonable. I was watching Morning Joe, which I do occasionally as a guest. I was watching it this morning, and Mike Barnicle, who is an old fart, Mike Barnicle said that he accessed healthcare.gov. It took him about 10 minutes for it to bump over to the Massachusetts Exchange. And once he was on the Massachusetts Exchange, he could have signed up in 10 minutes. So he waited, all told, about 25 minutes to sign up for health care.
Is the message here that if Mike Barnicle can do it, anyone can do it?
Absolutely, because Mike Barnicle is as low-tech a person, except for me. I said to Mike,
what do you have?
Except Mike was an old fart.
You have a flip phone?
I have a flip phone.
You don't have a BlackBerry?
No.
You don't have an iPhone?
No, I have an iPad.
You have an iPad?
Right. I have an iPad, but Mike's point was, if I can do it, a lot of people can do it a whole lot faster. And look, no one says it's perfect. And again, this is an extraordinary 7.2 million people in 3 days. I don't think anybody expected that level of. Remember, people have until March of next year to sign up.
Governor, devil's advocate question. The demand is great, as you said, 7 million plus. For all those members of Congress who are saying, you know, I have town hall meetings, we do surveys, focus groups in my district, and overwhelmingly, the vast majority of my constituents don't want Obamacare. They hate Obamacare. They want to repeal Obamacare, and that's why I'm doing what I'm doing. And you just said that the demand is overwhelming to jump on board and get it. Is there a disconnect there?
Well, one thing you should ask those congressmen is, they say that people in their districts don't like Obamacare. Ask them if they like the Affordable Health Care Act. There was a poll that showed...
Is there a difference?
Yeah, no, there's no difference, but there was a poll that showed... When people were asked, do you support the Affordable Health Care Act, almost 50% said yes. Do you support Obamacare? About 35% said yes.
How do you explain that?
Because people have no clue what's in the bill. They have no clue what's in the bill. They don't like President Obama, so they don't like the bill. These are people who desperately need health insurance. They haven't had health insurance since they became of adult age, and they don't like Obamacare. Well, where do they think they're going to get health insurance from? Health
That's
savings
someone who has
account?
a problem with Obamacare back there, Governor.
Health savings accounts? If you make $28,000 a year, health savings accounts are about as good for you as fairy dust. It's not going to work. Look, for all of you in the healthcare business, and I gave a speech to the Healthcare Insurance Providers Association, and I said, guys, you ought to work hard to make this work, because if it doesn't work, and I have a prediction, if it doesn't work, within 2 or 3 years after it craters, we will have single payer in the United States of America. We will have single payer. The Republicans say that this is socialized medicine. That's pure BS. The act was basically written by pharmaceutical companies and health insurance providers. That's who wrote this act. You want government takeover, single payer. And single payer will mean Medicare for everyone with the ability for people like you and I, Steve, to buy up.
Right.
Just like you can buy up in Medicare today. So you don't have to take that base care, but everyone in this country will get base care and single payer. And by the way, I'm astounded why private industry isn't pushing for single payer. Because if you're a steel company in America and you're offering health insurance to your employees, that's 12% of your bottom line. You're up against a German steel company that has zero health care in its bottom line. It doesn't seem to me that it makes a lot of sense. So I think everyone be careful, because if you try to destroy this, you're going to get single payer.
So real quick, before I move to the mandate question, Governor, how much of this, from your perspective and as an analyst with NBC, and you offer analysis that is always very grounded in real life politics because you've lived it for so long, how much of this opposition to the Affordable Care Act as a law is based in a personal, from your perspective, a personal vendetta, hatred, animosity toward the President of the United States?
Some. It's clearly a factor. It is absolutely clearly a factor. There's no question about it. And for the Republicans to say, the President never reached out to us. I want you to think back 4 years ago. Remember when President Obama essentially turned the writing of the Health Care Act over to the gang of, I forget what, gang of 8, but Senator Grassley, one of the ranking Republicans, was a big factor in trying to write this. And then it all blew up, and the president got, I think, no votes in the House and maybe 1 vote in the Senate for the Affordable Health Care Act. It all blew up. And the president, and by the way, I'm not alibiing for the president. If I were president, and I have no interest in spending 2.5 years of my remaining time on this earth in Iowa and New Hampshire. So, no offense to the Hawkeye State and the Granite State.
So you're officially announcing that you are not running for president?
Absolutely. But if I were president, what I would have done when they attached the demand, I would have said, guys, we're not going to do this. You're not going to point a gun at my head, at the government's head. That's not the way we do keep the government operating. That's not the way we do the debt limit. But you've raised some concerns. We're not going to get rid of the mandate. We're not going to repeal the act. But if you've got legitimate suggestions, I'm going to ask Speaker Boehner to give me 2 of your members. I'm going to ask Senator McConnell to give me 2 of your members. I'm going to ask Democrats in the House and Senate to give me 2. I'm going to appoint 4 from my administration. I'm going to appoint 4 from the private sector. And the 16 of you will have 90 days to come back and give me suggestions for amending, modifying the act. What that would have done would given Boehner the right to go back to his wacko caucus.
Is that what it's officially called, the wacko caucus?
Absolutely. They're certifiable. To go back to the wacko caucus.
Governor, back up. That's not fair. There is a legitimate group of people who have a different point of view than you do, and so you call them the wacko caucus?
Well, you just said it. You just said it. You suggested that they're motivated by hatred for the president.
I asked the question, Governor.
You implied it. You implied it. So the bottom line is then Speaker Boehner could have gone back and said, hey, we won. We won. The thing you need to do if you're an executive, mayor, governor, chairman of county commissioners, president, you've got to understand your side's going to prevail, but you're going to give the other side something that'll allow them to think that they prevail a little bit. And that would have been a perfect resolution to this. I can understand the president didn't want to, in any way, shape, or form, open up a precedent here, but you could have done that. You could have done that.
Let's talk mandates. There was some compromise here, Governor, on the employer mandate. It was put off for a year.
Right.
So what do you say to those who say, if you put off the employer mandate for a year, why not just put off the individual mandate for a year and there'll be no penalty? It won't be $90, whatever it is. It won't be a percentage of your income tax. Just put it off for a year. You say?
I'll be happy to answer that, but does anybody from Virtue want to answer that first? The bottom line is, without the mandates, and the individual mandate is the most important of all, without the mandates, there can't be an act. It's unfair to the insurance providers. Because what we have done is we've reformed the insurance provision system.
Right.
We've absolutely made it a law that insurers have to cover people with pre-existing illnesses. We've made it clear that when someone gets sick in the middle of their coverage, they can't be dropped. We made by law that you can't cap yearly or lifetime expenses, healthcare expenses. So what that means is a lot of people who are sick, who are challenged, who need a lot of medical care come into the system. And the only way it can be, that group can be afforded by the providers is to get everybody into this system, to get the healthy young people in, to get everybody in. You've got to broaden the pool so that we can take care of people who go in with pre-existing illnesses. I mean, someone from Virtue can answer me, if I'm in the early stages of lung cancer, my treatment, assuming that I survive for 2 years, what will my treatment cost? Anybody?
Got an expert from the system want to jump in? Anyone? I feel like Ferris Bueller's Day Off. Bueller? Anyone?
A lot of money, all right.
What is a lot of money? A lot of money, Governor.
Right. So we can't, in fairness, ask the insurance companies to absorb that without getting other people in. And by the way, we forget, there's a dry run of what's called Obamacare, the Affordable Health Care Act. All you have to do is get in your car and drive 5 hours north and see in Massachusetts, where 96.5% of the population are covered by health care, by Romney Care, where the mandate...
Is that officially what it was named?
Not only are they covered by health care, but the mandate worked in Massachusetts.
96.5%.
The mandate worked in Massachusetts. It was no big deal. Right. And I will say this, and Massachusetts companies did not go through what I think is the embarrassing. I would be embarrassed if I was a company that was making money And I took my employees down to 29 hours to avoid giving them health care. I think companies who do that, folks, should be ashamed of themselves. If they're making money, if they're losing money, I can understand it. But if they're making money, I have a small business with 6 employees. I would no more think of letting them be exposed and not have health care than I would in doing anything. I just can't comprehend how American business, and again, I'm not talking about all businesses, but how American business that makes record profits these days is talking about reducing someone to 29 hours so they won't have to give them health care.
But Governor, stay on that. For some employers who say, look, I want to provide with a 50 more or less, I mean, if it's more than 50, you've got to do what the government says you need to do under the law. For those employers who say, look, I want to do the right thing, my heart's in the right place, but if I do this, it forces me to A, not hire more people, expand the business, give bonuses that I would otherwise give, and frankly, not grow the business in a way that would allow for us to be the economic engine I want to be in the community. You're already giving me that face, which says?
It's pure bull. It's pure bull.
Why is that?
Everybody acts as if the cost of health care, basic health care, I'm not talking about a Cadillac plan, is going to break most companies. It isn't going to break most companies. It absolutely isn't. I mean, for me, in my business, I have 6 employees. One of them has an autistic son. One of them is in remission from cancer. Right. And what it meant to me, I'll tell you this, it meant to me, I made $50,000 less than I would have made the last 2 years. I make plenty. I make plenty. I would rather feel good about myself and good about what I do for people who work for me and give their heart and soul to me than make $50,000 more money. And I'm sorry. If that sounds idealistic, I am sorry. I am sorry. But the answer, if you guys don't want to do that, then the Chamber of Commerce ought to be for single payer. And everybody in this room ought to be for single payer. And we'll keep Virtue around because we'll have the plus-up plans. You guys can write all the plus-up plans.
Join me tomorrow night as I continue my one-on-one conversation with the former governor of the Commonwealth of Pennsylvania, the Honorable Ed Rendell.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, New Jersey Manufacturers Insurance Group, PSE&G, Fedway Associates, Inc., the Russell Berry Foundation, and by Cone Resnick. Promotional support provided by the Star Ledger and NJ.com, and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.